been some type of medical field, if you think about it. Years ago, when doctors were not in existence, there were still people that cared for one another. They were compassionate, and they were the caregivers. Today, medical careers and the medical field itself is a phenomenon. However, there's one career that is not talked about much. It's phlebotomy. A lot of people get their blood drawn, yet never know the name of the nurse that performs this vital task. Hello, I'm here today to tell you all about phlebotomy. A little bit of career information. A phlebotomist is one who draws blood for analysis or transfusion. They work at a hospital, a laboratory, a doctor's office, or more commonly, the blood bank. They deal with potentially infectious specimens, so they're required to wear PPEs. PPEs are personal protective equipment that guard the body and keep the specimens out of the phlebotomist's way. Training and education. They must complete a phlebotomist certificate program or continue school to get their diploma. This has been noted by the American Medical Technologists Organization. Schooling varies in length. They can earn an associate's degree and still work on the job training. Requirements for phlebotomists. According to the video interview with the phlebotomist posted by Colleges and Degrees, Debanthia informed me about phlebotomy and a certificate of training is required. Some states require licensure, others don't. However, having this license can help obtain the job position much more easily. You must have training involving hazardous materials. This training provides guidance. You must have characteristics that fit the job. You must be calm, cool, and collected. Also, patience is the main key in phlebotomy. Phlebotomists must be able to locate the vein as painlessly as possible. Now that I've told you a little bit more about the career itself and the job requirements, let me move on to drawing blood. Nobody likes it, however, it's a requirement for some patients. Patients need to know their current health status. Blood tests are beneficial not only to the patient, but the doctor as well. It can lead the doctor in the right direction for treatment and inform the patient if they have a life-threatening disease. Blood tests can also determine the red blood cell count along with the white blood cell count in the overall blood count. White blood cells, if you have too many, can indicate an infection in the body. While white blood cells fight off this bacteria and infectious material in your body, it can show an infection causing a fever and show the doctor the right thing to do for treatment. Blood tests can tell patients if they have a life-threatening disease or if they just have a disease they need to work on with medicine or any type of therapy. Phlebotomists use the inside portion of the elbow to retrieve blood. Sometimes they use the back part of the hand, whichever is easier and less painful for the patient. Notable veins. Now that you know a little bit more about the job aspect, let me tell you about the vessels. A vein, according to 2000 printed edition of Anatomy and Physiology by McGraw and Hill, it is an elastic blood vessel that transports blood from various regions of the body to the heart. There is the pulmonary vein, deep vein, superficial vein, and systemic vein. Pulmonary veins are blood vessels that are filled with oxygen, carrying it to the left atrium of the heart. Deep veins are located deeper within the body, carrying majority of the body's blood. Superficial veins are closer to the surface and usually are easier to obtain and retrieve blood from. Systemic veins are veins that drain into the right atrium, not only for blood samples. Now, you might be wondering, a phlebotomist only draws blood for analysis? That's not true. They draw blood for transfusions, donation, and of course analysis. It's hard to find a needed blood type for transfusions. It is said that 1 in 1,000 people inherit a rare blood type by the Blood Book website. This website offered a list of blood types, and the one occurring the most in every race was O positive. Over 600 types of antigens are known about, and only one nurse can handle this job responsibility. It is the phlebotomist. Thank you.
How long was that?